and hello everyone. It's a pleasure to be here today, and it's been an absolute pleasure to work with Liz and the team on this project and to have been involved from the start. So I'm sadly old enough to remember what came before SARCs, and for anyone who doesn't know, that involved opening up a piece of brown paper, the victim standing on it, and then being stripped off so that all of the forensic evidence could be gathered up in that brown paper package to be analysed. So it really wasn't trauma informed, it wasn't victim focused, it was pretty horrendous experience for victims, regardless of anything else they've been through. So SARCs, absolutely wonderful invention and really welcomed. And I guess the fairest thing to say is that they've been set up and operate in different ways across the country. There is huge variation. And I think always when there is a question around the work that SARCs do, the feedback is really good. Victims really welcome that focus. They welcome the expertise and the sensitivity of the staff, but there's always room for improvement. And in the sector, the Survivors Trust is a membership organisation. We have over 120 specialist voluntary sector member organisations throughout the UK. And we hear feedback from our member agencies, from independent sexual violence advisors, and from survivors themselves of their experiences of attending SARCs. And our work tells us that huge numbers of victims and survivors have either diagnosed mental health conditions or go on to experience mental health issues. And part of that might include substance misuse, alcohol, increased use of alcohol. So it's this study, when I was invited to join it, I leapt at the chance because I knew how important it is. And it has been a real pleasure to work with Liz and the team, and to be able to contribute towards identifying where to focus, identifying agencies that could be involved, and supporting generally how the study progressed. So I think really, I don't think there's anything very much more else for me to say. Just a big thank you to Liz and the team, and really looking forward to this study being published because it's so needed. The ability to shine a light on victims and survivors who are potentially the most vulnerable with mental health and substance misuse issues, really excellent. And looking at the outcomes for them longer term, it's really crucial work. So lovely that you're all here, and thank you, Liz. I'm looking forward to the presentations.
Yeah, that's great, thank you. And it's been great working with you as well, Fay, and we really valued your input, especially from your perspective as well. It's been really, and I know Fay has helped us with our lived experience input for sure, which has been also really valuable as well. Okay, so thank you, Fay, and I